Hi, welcome to Kaleidoscope Medically Speaking. Each month, we'll explore a variety of topics to help you better understand certain medical conditions, treatment options, and topics in healthcare. My guest today is Dr. Joshua Lynch, the Director of Emergency Medicine at DeGraff Memorial Hospital. In this episode, we'll discuss recent changes at DeGraff and how the facility is repositioned to continue to provide excellent care for the community. I'm Mike Hughes, and this is Medically Speaking. Welcome, Dr. Lynch. Thanks for joining us today. I want to talk to you a little bit about DeGraff Hospital, some of the recent changes that we're seeing there. But if you can first, talk a little bit about the new emergency room there that's been open for about 18 months now. Yep. Talk a little bit about that project and how that's really kind of changed the North Tonawanda facility for Kaleida.
So we're really excited to have a brand new emergency department at DeGraff, and it is really a state-of-the-art facility staffed with board-certified emergency physicians. And it really has all the technology that you would find in the emergency departments at a bigger hospital, such as ultrasound, imaging, things like that. So we're really happy to have that there, and I think the patients really appreciate the fact that you can get in and out of that emergency department pretty quickly.
You mentioned board-certified physicians. Why is that so important? If you can tell us a little bit about that, and then the physicians that work at DeGraff, where else do they work in the Kaleida system or other hospitals, and why is that important?
Right, so the fact that the emergency physicians that work there are board certified is really important, actually. And that means that they have gone through specific dedicated training to emergency medicine and have passed a series of board exams that kind of prove their competency. Now, you might wonder, well, doesn't everybody have that? Actually, They don't. A lot of other specialists in other hospitals work in the emergency department, such as family medicine. Sometimes you find other specialists that do, but having everyone be board certified really keeps the standard of care the same. So that's important, that we can quickly diagnose emergent conditions, in a timely manner. But the other interesting thing about the docs that work at DeGraff is that they're part of a group that works at hospitals all over the place, all over Western New York. So particularly Buffalo General. And at times, some of them will work at Oshai Children's, and a lot of them work a lot of the time at Millard Suburban as well. So you're kind of getting physicians that work at these big hospitals treating you right in the community.
Right. So you're the Director of Emergency Medicine at DeGraff, and you've seen DeGraff's evolution in your 10 years in healthcare from a community hospital that really was kind of offering an awful lot of services to really focusing in on outpatient in the emergency room. So if you can talk a little bit about the changes that they've gone through and that what's being offered there today.
Right. So we have decided really to focus on emergency medicine care at DeGraff. And that's something that I think we do very well. And kind of with that said, we are really consolidating down to having that be the primary service offered there. So it's what you see is the emergency department, but what also is still intact there are the kind of support services that go along with emergency medicine, such as x-ray and CAT scan and lab and pharmacy. So all those services will still be there to support the emergency department.
So it's not just your typical, quote, urgent care. This is a full functioning emergency department.
Right. So we have been working with the EMS agencies, the ambulance companies around town, and have explained to them that we, not only are happy to and comfortable taking care of emergencies such as strokes and heart attacks and cardiac arrest, but we expect to continue to care for that there. So, far more than an urgent care. It's truly an emergency department like you'd find in any other hospital, just without the hospital attached.
Right. So when we talked about the board certified physicians, you talked about some of the docs also work at the Kaleida facilities. Why is DeGraff an important part of Kaleida's network, and how do people end up going from North Tonawanda to maybe downtown Buffalo to the Gates Vascular Institute? Why is that connection important?
Right. So I talked a little bit about how efficient it is there. So on average, over the last couple of years, when a patient walks in the door, gets wheeled in the door, they're seeing a doctor within 20 minutes. And getting in front of that board certified emergency physician, and then having the ability for them to know the physicians that work all over the system, at Gates particularly, we can have a transfer that goes very smoothly, either if the patient needs to go downtown to Buffalo General.
And when you say smooth, let me interrupt you, that's not just from a getting them there quick, but that's also making sure that everything, the process itself, the transport with the ambulance company, the communication with the physicians and getting there in a timely manner, that's when you talk about, it's smooth, right?
Yep. So not only just like the transfer itself, but also when we call downtown or to Millard Suburban, we're talking to our colleagues because we work at those hospitals too. So not only is like the physical move fairly easy, but when they get there, kind of the plan of care is really kind of already in motion, right? Whether it's talking to a specialist before they arrive or talking to the doctor that's going to be admitting them.
Right. And then so a lot of the docs or the staff management, it seems like Suburban and DeGraff are doing a lot of alignment these last couple of years. If you can talk a little bit about that and why that's important for those, especially in the North Towns.
Right. So Suburban offers a whole bunch of specialty services. And we like to think of when a patient comes into DeGraff, like that, they're able to access those services just as easily as someone who would be walking into Millard Suburban.
And then what about the services at DeGraff in terms of therapy, cardiac rehab, skilled nursing? If you can talk a little bit about the changes that may have occurred there or what's remaining.
Yep. So the skilled nursing facility really remains intact and essentially unchanged from what we have been used to there. It's an amazing place for patients, it's an amazing facility. But also the therapy and rehab services that are located in the wellness center are great. And actually they provide some therapy services that are really hard to find across Western New York, such as like lymphedema therapy, but physical therapy, occupational therapy, speech, really kind of all the therapy type services and cardiac rehab are all remaining on the DeGraff campus. And at times the physical therapist will come over to the emergency department and evaluate somebody right there. So again, it's just really focused on the patient and efficiency, and it's worked out really well.
With the emergency room project, the old ER used to be in the back of the campus. Now it fronts the Twin City Highway there. If you can talk about accessibility, where do people park, and just the ease of access getting into the building.
Yeah, so the move to the front of the hospital really was a big win for patients. And so the parking is free. You can park steps from the front door, but parking right off Tremont Street as soon as you come in off Twin Cities Highway is super easy. You can come right into the emergency department. You'll see that if you haven't been to the new place is very bright, wide open, very clean, very modern. And it's a great place.
Well, it seems like you guys have really responded to the community and all the changes in healthcare, especially in the Twin Cities. Good luck with the rest of this year and all that you guys are doing at DeGraff.
Great, thank you.
Thanks for coming on today. I'm Mike Hughes. We'll see you next time on Medically Speaking.